All right, I'm back because I wanted to share another case with you. I thought this was just too cool not to share because we just did an example of this case. We just showed an example. It's not the most common case that there is. And so sometimes it makes me wonder if you diagnose two slightly rare things right after another, is there some type of clustering effect where something environmental is making something more likely to occur? Is it that you're just recognizing it because of heuristics, you've seen it recently and then you're diagnosing it? I'm not really sure what the answer is, but I just think this is too interesting that a week apart I diagnosed two cases of this when this is a fairly uncommon entity, relatively speaking, in central Ohio, which is where I'm located. So what are we seeing here? This is a patient here. These oval, round, maybe slightly dusky to violaceous, pink annular patches. Annular meaning that it's ring shaped, so you can see that the center has a little bit of clearing compared to the peripheral violaceous to pink rim. So here's another example. See, it's nicely annular, nice central clearing surrounding violaceous rim. And so I just reviewed in the last two videos eosinophilic annular, sorry, not eosinophilic, but annular urticarias or annular erythemas, where there's a differential of EAC, tinea corporis, Lyme disease, GA, tumid lupus, subsportum lymphoma could look like this. If you have an individual patch of this, you could think of morphia. And we showed that the case that we had previously was a person who actually had Lyme disease. And interestingly enough, this is another example of it. When I was reviewing the clinical photos, I was between fixed drug eruption, which is on the differential diagnosis, a weird multifocal morphia, though it's not good for that, and Lyme disease. And it turns out serologically, this was confirmed to be Lyme disease as well. So I think it's kind of an interesting example of two fairly uncommon cases clustering here together. And you can see the similarities if you go back and review the other video in the truncal to extremity distribution, the annular nature, because of the migratory nature of this condition, lends itself to an appearance of peripheral violaceous to pink erythema and central clearing. And then the fact that it's hard to kind of put this in another bucket. It doesn't have the scale of tinea corporis, doesn't have the scale of EAC, too multifocal for morphia, and then not dusky enough for fixed drug. So this is another case of Lyme disease.